According to the American Medical Association, 26 million Americans suffer from migraine headaches. Many have tried all kinds of treatments, but nothing seems to stop the debilitating pain. But a doctor from Ohio says he's found a remedy for migraines, and it involves a little nip and tuck. 360 MD Sanjay Gupta shows us how it helped one woman.
Or something, and the pain sometimes would just make me cry.
48-year-old Kathy Kramer is describing migraine headaches that life since college. The precious days she wasn't bedridden or writhing in pain were spent worrying about the next headache.
You don't live your life normally like other people do. It's debilitating, yes. And then you worry every day whether it's going to happen.
Then, through the painful haze, a glimmer of hope.
It was some kind of promo like, we have a cure that'll even actually make you look younger.
A promise to relieve migraines through plastic surgery. Dr. Baman Gayaran, a surgeon in Ohio, is the man behind the promise. He noticed an interesting side effect in patients undergoing plastic surgery. Their migraines were vanishing as rapidly as their wrinkles.
They said, not only I'm happy with what I see, I haven't had migraine headaches for a while.
After several studies, he and colleagues devised a surgical technique targeting muscle groups around the septum, in the forehead or frowning muscles, in the temple, and the base of the skull. Places Gayaran says pressure nerves, which in turn causes migraines. The surgery's premise, remove the muscles and nerves to alleviate that pain.
So we see the muscle right in the center now.
The consequence of surgery, according to Gayaran's most recent study, 92% of patients saw at least a 50% dip in the frequency and intensity of their migraines. But some neurologists, like Dr. Seymour Solomon, question those findings.
These numbers are accurate, but the methodology makes them meaningless. It's completely contrary to what we know about the mechanism of migraine. Cutting a couple of muscles here should have no effect.
Dr. Gayaran is not claiming his surgery is a total cure, but believes it has potential.
We really are not eliminating that tendency for migraine headaches. For the practical purposes, if the patients are symptom-free and continue to be symptom-free, we have cured them from the condition.
Do you do any tricks?
2.5 years after her operation, Kramer experiences minor headaches infrequently, but
Basically, I would tell you I have had 0 migraines. You realize there is a freedom that I had never had in my life, and you go, this is life-altering.
So, Sanjay, this looks pretty interesting, at least. Who qualifies, though, for this kind of surgery? And you'd have to ask if it's covered by insurance or not.
Right. Not everybody's going to qualify for this operation. Really, this doctor is one of the only doctors doing this operation now around the country. Very selective about who's going to have it done. At least 2 or more migraines a week. And you have to have tried migraine medications, and either they didn't work or you had significant side effects from them. He's also right now mandating that a neurologist actually make sure that, in fact, the type of headaches that you're having are migraines. You're right, insurance doesn't cover this right now. It's pretty expensive, actually. For each target area that's focused on, about $4,000. So let's say you have 3 target areas in the forehead, behind the ear, and the back of the head. That'd be about $12,000. So fairly expensive as well, Heidi.
Yeah, I guess, but I can hear some people's minds clicking right now.
That can be really debilitating, so anything that works, yeah.
All right, Sanjay Gupta, thank you so much for that.
Thank you.